Indeed, it's a pleasure and honor to be here with you all this occasion. Like the MC mentioned, it's indeed a very, very beautiful afternoon with this breeze playing upon our hair, I guess. And High Commissioner, it's a pleasure to be with you here for another joint venture with the Australian government. We met last Friday in the heat of Reki to do the groundbreaking ceremony of Waimaru Health Centre. And today, quite a contrast in the weather here at Navua. And thank you, Dr. Anna, and your team for organizing this. As you've heard, ladies and gentlemen, we are here for the official handing over of the biochemistry analyzers equipment for diabetes management. A lot has been said by Her Excellency, but first and foremost, please allow me to put on record the Fijian government's utmost appreciation to the Australian government for its continued partnership and commitment towards the development of health services in Fiji. I'd like all of us to put our hands together for this generous gesture. Thank you. Your Excellency, truly through the assistance that your government has provided to the Health Ministry over the years conveys the Australian government's passion and commitment to reach out and contribute tremendously towards the development of Pacific Island nations like Fiji. We take great pride to honor and nurture partnerships of this nature that brings hope, peace and prosperity for our nation and the world alike. Having said that, it also provides motivation to unfold new partnerships with the potential to create developments in the health services, especially for us in Fiji. Ladies and gentlemen, as mentioned, the increasing cases of non-communicable diseases is becoming a great burden for our nation. And of course, you're aware in the Pacific as a whole. And with top on the list of NCD concerns is diabetes and its complications, which is a major cause of death and disability in Fiji. One of Fiji's key challenges is that many cases go undiagnosed, resulting in many people accessing healthcare services at a very late stage when the conditions get complicated and too expensive to manage. This results in poorer health outcomes, particularly it incurs higher rates of amputation for diabetes, foot sepsis and premature death, and higher healthcare costs as well. According to the data collected by the Health and Information Unit of the Ministry of Health in 2015, a total of 669 amputations were done, and similarly in 2016, a total of 791 amputation numbers were recorded, and I'm sure you can guess the statistics for the future. The statistics further shows that the amputation rates increased from 12.1 to 12.6% from 2015 to 2016. And like I said, it's obvious that the rates are increasing and will increase. Therefore, ladies and gentlemen, these statistics convey the alarming consequences of diabetes among our population and, as mentioned, our young population. In October 2015, the Fiji Health Sector Program conducted a rapid assessment of the subdivisional laboratories to identify ways to improve the accuracy of and the speed in which NCD test results were reported back to healthcare providers. 9 of the 15 laboratories assessed showed the need for at least one extra laboratory technician to accommodate the increase in the number of NCD tests ordered. The assessments also revealed that available equipment needs to be upgraded to enable HbA1c and cholesterol testing. So having these modernized equipment that will be handed over to us this afternoon would mean that our doctors will be able to provide a clear picture to the patients on the status of their diabetes level, and in doing so, the patients will be able to take appropriate measures to prevent themselves from detrimental impacts of diabetes. All in all, having these equipment would mean for us to be able to have early diagnosis, being able to decrease the complications of diabetes, which results in blindness, kidney failure, and amputation, as being some of the most severe life-threatening complications. Ladies and gentlemen, the total cost for the laboratory biochemistry analyzer, the distillers and computers are as stated 382,266 Fijian dollars. Again, as mentioned by Her Excellency, the equipment will be provided to top 6 facilities based on the current testing needs, namely Reki, Tavua, Taviuni, Navua, Levuka subdivisional hospitals, and of course, Senganga Health Centre. On another note, Fiji's biomedical technicians have also been trained in the maintenance and repair of these machines. Installation and commissioning of these new machines will be undertaken by the supplier in consultation with FPBS and our laboratory staff. Having these new equipment at our health facilities, ladies and gentlemen, will ensure efficiency in terms of diabetes management, which will mean being able to take charge of one's health and, of course, one's life. Accessibility of these equipment would motivate people to seek early diagnosis and thereby preventing long-term complications to save lives. So at this juncture, I would like to also reiterate that tackling the increasing cases of NCDs doesn't mean building more hospitals, bringing more medicines, or bringing more equipment. NCDs can truly be tackled through a collaborative effort, particularly when our people start taking their health seriously. Of course, we all know NCD is a lifestyle disease. We need to take control of our lives if we are to tackle this killer. And to defeat NCD means one has to be committed to making healthy choices on a daily basis. Eating healthy, eating the right food with the right amount, and exercising daily. And this is, I think, one thing that our Fijians are neglecting. My humble plea to all the Fijians would be take ownership of your health. NCD effects can be reversed if only we make those choices, if only we commit to live a healthy life. Everybody can live longer, but we want our people to live a longer and a healthy life. Our doctors can only advise you on what needs to be done when it comes to making the real change to prevent NCDs. And again, it's about the choices you and I make. So I appeal to the individuals, and I appeal to families, and I appeal to all our Fijians to make the change for yourself and your families today. And for those that you truly care for, your children, your spouses included, to choose a healthier and a happier life. So ladies and gentlemen, let's close this beautiful, beautiful afternoon with once again thanking the Australian government for its tremendous support in helping Fiji build its health services. And similarly, I would also like to thank the Fiji Health Sector Support Program team for a job well done, and wishing you all the very best in your future endeavors, and thanking everyone who has in one way or the other contributed towards the development we are going to unveil shortly. To the staff of Navua, Dr. Anna, you and your team, thank you very much for the services that you provide on a daily basis to our people from Navua and the surrounding areas. To you, I plead that you make good use of the equipment provided and ensure that it is properly maintained. So with these few words, ladies and gentlemen, I thank you very much, and may we have a blessed afternoon for the rest of the program. God bless you. Be healthy. Go home safe to your families. Thank you.